Hello,
Hello,
I am Preeti. I am the ST5 in the labor ward today, and you are?
I'm Sandeep. I'm a student.
So, Sandeep, I can see that you are new in the hospital. How are you finding the hospital?
It's good.
Okay, you are gelling in well with everyone.
Yeah, that's good.
So, I can see that you want to read and learn about partograph. So, can you please tell me, is there any specific reason why you want to learn about partograph?
No, but it's interesting. Some people are doing some work over there.
Mm-hmm.
So I'm interested in this partograph.
Mm-hmm. Have you seen anyone doing this?
Yeah, my senior was doing.
Mm-hmm.
So he told me that I will teach it.
Mm-hmm. Yeah, of course, I can help you with that. So let me see if you have seen this paragraph. So this is how it looks. You have seen it, right?
Yeah.
Yeah. So this is how the paragraph looks like, and it has got different parts in it. So it has got the identity of the patient, then it has got the fetal heart rate, it has got the progress of the labor, and it has got the maternal condition. Okay. So there are different charts where you have to fill in those charts and you have to find out the progress of the labor. So why this partograph is important, first of all? So why is this important is because we have to find out if there are any problems during the labor. Say for example, if the patient has come to you in labor and is having delay in the labor, or if you have to shift the patient to some tertiary care center, so in that case what time you have, how much time you have, and you can just anticipate that from this labor chart, right? And another important thing is for the medical legal issues. So if there are any medical legal issues, again that gets sorted with this labor chart. Right?
Okay.
So I have told you about the different components of the partograph.
Yeah.
So are you with me? Am I going well?
Yeah.
So can you please tell me the different components of this partograph?
Fetal heart rate, then progress of labor, and then maternal condition.
Yes, very good, very good. I must say you are a very good learner, Sandeep. So let's go with this fetal heart rate. You have to just chart this fetal heart rate after every half an hour. So you have to keep on checking this fetal heart rate. And there is a method of checking this fetal heart rate. You just cannot go and check the fetal heart rate during the contractions because there is a chance that it may not be the correct heart rate. So you have to check it for at least 1 minute after the contraction is gone. Okay, so that is the way to check that, and you have to mark it as a cross on your table here. So if it was 130 initially, then you have to mark it as 130. So I've already done it for you. See, if it was 150 on the next time when you saw it, then you have to just mark it exactly like this, right? Another one is for the amniotic fluid. Amniotic fluid, you have to see whether there were membranes were intact or not. If the membranes were intact, you have to write in I. If the membranes were not intact and you could feel that the membranes were ruptured, you have to find out what type of liquor you had, right? So if you had a clear liquor, you have to write C. If you had blood stained liquor, then D. Then if it was meconium stained, M, right? Then with the molding. So what is molding? So it is basically important. Why we see for molding is it's basically important to find out if the patient has got any CPD. Okay. So if that is the case, then there are different stages as I told you. Stage 0 is when the bones are apart, the fetal skull bones they are apart, and you can feel the fetal bones. Right. Second is when they are touching each other. Okay, but they are not overlapping each other. Third stage, that is 2+, is when they are actually overlapping each other, but you can just resolve it. Okay, so they are reducible, and that is 2+. And 3+ is when they are non-reducible. The third thing that you have seen here is the progress of the labor, right? You can see that there are two lines here. One is the alert line and one is the action line, right? Alert line, you have to mark things on the alert line. Before this, anything that comes before this is normal progress of labor. After you go through the alert line, of course, you have to be alert, as the name suggests. And once it crosses the action line, you have to take some action, right? You have to have some intervention with the labor. Okay, so that is what the name suggests. Okay, so it starts once the active phase of labor starts. Okay, so if the patient comes to you and the patient is, say for example, 5 centimeters, so where are you going to mark it? You are going to mark it on the alert line only, right?
Fine.
Right? and then you are going to you are going to do the examination after 4 hours, right? So after 4 hours, if you find that the patient did not do well and the patient is not progressing, say for example after 4 hours she was only 6 centimeters, so now she will be coming on this line, so near here, so she is somewhere near the action line, right? So that is what is causing the delay in the labor. Say for example after 4 hours if she was 8 centimeters, so of course it is going to be good for her and she is going to deliver. So these are the 2 lines. Can you please tell me what are these 2 lines?
One is alert line and second one is action line.
Right? So this is plotted as 1 centimeter per hour.
Also, you have to chart the descent of the head, 5/5 palpable or 4/5 as circle.
Okay, so you have got hours and you have got the time here. So how many contractions were there in 10 minutes? Okay, and what was the intensity of the contraction? So there are 3 different types of contractions. So one is mild, one is moderate, and one is severe. So if the patient had contraction for less than 20 seconds, then the contractions are mild and they are filled in as dots. Okay. If the patient has got moderate contractions, then they are filled in as dashing lines. Okay. And if the patient has got severe contraction that was for more than 40 seconds, then it is filled in as a completely dark square. Okay, so coming to this is actually the number of contractions the patient had. Say for example, in first 10 minutes the patient had got 2 contractions, so it's 2 mild contractions, and the third one was a little severe, so you may just write this one. Say for example 20 to 40 minutes it lasted, so the third one is like that, right? Then oxytocin, whether you have given oxytocin, generally we give 5 units of pitocin, isn't it? So how much oxytocin you gave and for how long? Then the drugs that you gave to this patient, pulse and BP of the patient. So BP, if it is to be written as 2 arrows, so if the diastolic is written below, of course, 9 if it was 90, and then it went to 110. So 110 by 90 is written like this. Pulse you have to write as dot. Okay, it is already mentioned here, so it helps. And that is why partograph is easy. So for example, when you did this BP, the pulse was 90, so you may just draw this small dot. Okay. Then again, the temperature of the patient. What was the temperature of the patient? So can you please tell me, do you know after what temperature you have to take action?
More than 38.
Yes, 38 degrees centigrade. Of course, you have to be alert. So again, this is a very important thing to remember. So things should be below this. Urine, whether there was protein or acetone in the urine, and what was the volume of the urine. Okay, so you should be knowing when to take action. Okay, so you have to keep a record of half-hourly documentation of the contractions and hourly pulse of the mother. Okay, 4-hourly temperature and blood pressure of the patient, and also you should be knowing when there is a delay, what to do when there is a delay. Okay, so when there is delay in the first stage of labor, you should be first able to detect it. So for that you should be knowing the normal range. So what is the normal range of FHR? That is 110 to 160. So anywhere if it goes beyond that, of course you have to inform your seniors and you have to go by the protocol of the hospital. So if the cervical dilatation is less than 2 centimeters in 4 hours, then it is delay in the first stage of labor. Also if there is no descent, if there is no rotation of the baby, okay, so again this is also delay in the first stage of labor. So in the second stage also you have to keep on seeing whether there is contractions, there is active maternal effort. Birth should be expected. It should take place within 2 hours from the start of the active second stage, whenever the second stage gets started. And once you have written this, at one glance you can just see and find out if the patient had a good labor and whether it was normal and what was the course of her labor and if she landed up in cesarean section. So how do you like this partograph?
Yeah, nice. Very interactive.
Yes. So do you feel that this session of ours was useful?
Yeah, it's very nice session.
So I'll give you some videos to see how to fill in this partograph. Alright, and I'll also give you some links to read about this, the theory material, and the next time I fill in this partograph, I can ask you to come to the labor ward if you are there. How does it sound?
That's nice.
Okay, sure.
Okay, thank you.